You're listening to a Raconteur Studios podcast.
Hello and welcome to the After Hours Skin Clinic, the podcast that takes the skin talk beyond the clinic doors. I'm Dr. Emma Craythorne, consultant dermatologist and host of the After Hours Skin Clinic. And this episode is a listener question special. And I'm joined again by the lovely Dr. Ellie Rashid.
By your favourite person.
Before we get into the episode, if you like what we're doing here at the After Hours Skin Clinic, then please give us a follow, share us with your friends and family, or give us a shout out on social media. It really helps people find us. We also love receiving your questions, so keep those coming. Anyway, enough of that and on with the episode. Hi, Ellie.
Hello.
So first up, we have a couple of questions that have come in on back acne. I know this is your chosen specialised subject.
I love acne.
I know
wherever
you do.
it is, whether it's backney, chestney, buttney.
I knew you would say that at exactly the same time. Okay, so the question came from Lily. How do you combat body acne? And she's somebody who's come off hormonal contraception. What does she do? And then my sister's friend, remaining nameless, as a woman in my 40s, what are the best things to treat butt acne with and properly eradicate for good?
The treatments for acne affecting your back or your bottom would be very similar to the treatments that we give for acne affecting your face, but with the caveat that most of the solutions or active ingredients are usually in very small little tubes.
Yes.
And there's often not enough of it to go around for a large surface area that affects your back or bottom or chest, etc. So systemic treatments is fine. You're taking a tablet, it's going to treat all of it, if you like. But the topical solutions with the active ingredients, that's a lot more tricky. But there are now formulations. So azelaic acid, for example, is a lovely ingredient to help reduce inflammation associated with acne. And the other thing that's really great is now that we have identified that there are ingredients that can be really helpful for acne, like salicylic acid, we've now put it into washes in these big sizes. So CeraVe do a salicylic acid cleanser that I think is wonderful for acne affecting the body skin.
Do you have to leave it on for a period of time? Do you tell people, or you can just wash with it and it just rinses off? Or do you put it on your body and rub it in and then step into the shower? How should somebody use it?
I just ask them to use it as their shower gel. So literally just to rub it on, leave it on, and then maybe for like 30 seconds and then just wash it off as they normally would.
Yeah, because if I'm in the shower and I'm putting something on, it just washes straight off with the water.
Stand a bit forward.
Too tiny a shower. What about things like ketoconazole, Nizoral? Do you ever use that for people with back acne?
I'd use it for like a malassezia folliculitis, but I haven't used it so much for acne. Do you use Nizoral for acne?
Sometimes, yeah. It's quite a nice anti-inflammatory, yeah.
Oh God, you're perpetuating the fungal acne craze.
No, I mean, it's more that ketoconazole is a nice anti-inflammatory. So there is a difference, I suppose. So what is the difference between this fungal acne and back acne?
So fungal acne it's not a real true acne. It's a inflammation of the hair follicle secondary to a yeast that's on our skin called malassezia. So the true terminology that one would use is malassezia folliculitis. But if you were to look on social media, you'd think that fungal acne affects every single patient that comes into my room because there's so much about it. But acne, secondary to this overgrowth of Cutibacterium acne, normally as a result of more sebum production on the skin and this keratin clogging up pores on the skin, that's a true acne, and that's by far more common.
Yeah. So I think that if you think you've got acne on your back, a good way to look at is, have you got blackheads? Have you got little whiteheads? Are they pustules and papules that are all different shapes and sizes? Whereas if it's what gets called a fungal acne, but it's actually a little yeast, a malassezia yeast, they all look pretty much exactly the same size, and they're all centered around a tiny little hair follicle, and they're all really, really small. And they often come because of sweaty environments or carrying backpacks or, lots of lycra clothes. I see it in lots of footballers. That is the two different types. So you have to understand which one it is. And if it is this every single spot looks exactly the same and there's no blackheads or anything and you don't have acne anywhere else, then you do have to have a little think, is this a malassezia? And if that's the case, 2% ketoconazole in the form of Nizoral shampoo. I say to somebody, just put it on your skin, on the back, leave it for a few minutes to settle in, and then rinse it off in the shower. So sometimes put it on, brush your teeth, and get in the shower.
Yeah. And then in terms of antibiotic lotion, I tend to use something called Dalacin Tea lotion or topical clindamycin. Again, that comes as a lotion, comes in a relatively large size, and you can apply it onto a large surface area.
And if you want to know more about fungal acne, we've done a whole episode on that, so you can give that a listen. So if this is then a true acne and you've tried all of the topical treatments that you've recommended, the next step has to be taking a tablet by mouth, right?
Yeah, so a tablet by mouth, usually an antibiotic to reduce inflammation, not to treat an infection. And you take typically limacycline or doxycycline, usually once a day for a minimum of about 6 weeks, an average of about 3 to 6 months, and an absolute maximum of about a year. But in some cases, you can go on for longer. And that can help to treat all the areas that are affected with acne. And I'd normally combine those antibiotics with topical treatments as well. And if you're still not winning and the acne is still a problem, then there is the option of going on to Roaccutane or isotretinoin, and that can very effectively reduce all of the clinical features of acne. And of course, it's typically about 6 or 7 months. And in that circumstance, you wouldn't be on anything topically apart from a gentle cleanser and a moisturiser, but you wouldn't be on any active ingredients that can irritate the skin.
And of course, it's quite important to mention hormones, because sometimes hormonal imbalances or changes can also play a role in acne on the body. So particularly for women, just simply starting on an oral contraceptive pill to stabilise those hormones can be effective. Sometimes taking a medicine called spironolactone can be effective for people who have polycystic ovary syndrome. And it's really important to know that for somebody who might get an eruption of acne on their body, that can also be if they're taking other steroids or other tablets by mouth. In fact, steroids that you're hitting the gym with, anabolic steroids, are a big trigger for body acne. We keep getting questions about lip balm. So shall we clear that up?
Well, if you know me, you know that I walk around with my little Vaseline rosy tint.
I know you do.
All the time. I'm obsessed with it. So it is important to keep your lips well hydrated. It's actually important to keep your lips protected from the sun as well.
I would say that's more important. Rosy tint girl.
So to use a lip balm that has some sun protection within it over the summer months is really important. And actually you can do that all year round. You can get some really nice formulations now that don't feel tacky on the skin and really thick and occlusive. They actually melt into the skin really nicely. It's good for keeping your lips well hydrated in the winter when the humidity is really low. Your lips can get sore, cracky at the side. So yeah, I love a lip balm.
Some of the lip balms do have quite a lot of irritant ingredients within them, weirdly. So for some people, actually, the application of a lip balm can actually irritate their lips. And so they then feel that they need to put more lip balm on because their lips are irritated. So they get caught in this perpetual cycle of needing to lubricate their lips all the time.
Their biggest issue is lipping, where their saliva just irritates their lips as well. And they get this cheilitis, this inflammation of their lips, essentially is what cheilitis means. It can get red, sore, swollen, flaky. And sometimes you can get like this red ring all the way around it. And children actually suffer with lip licking cheilitis or dermatitis in and around their mouth. And yeah, you can't get into that cycle of the drier it feels, the more you lick your lips and lick the skin around your mouth. And then it just makes the whole problem worse. So a good barrier is really important. So a nice lip balm, something that you like the feel of. I really like using like nipple balms, like things like
the Lansinoh nipple balm.
Lansinoh nipple balm.
You know, Lansinoh Lipple. Well,
Lipple
actually,
balm.
Lansinoh have now brought out a lip balm. So you don't now have to get the teenage boy who's on isotretinoin to go in and ask for the nipple cream to put on his lips. They now have brought out a lip cream. It was a patient told me this just at the weekend. I love Lansinoh lip cream now, I can say. My advice is that unless you're somebody who does have lips that dry out quite regularly, then you don't really need to put a lip balm on every day. At times, whenever you're maybe in a very, very cold environment, so winter, skiing, these kind of environments can often dry the lips out. It's a good time to put on something that's very simple and plain and straightforward that won't run you into the idea of then getting this vicious cycle of the skin being irritated and therefore you need moisture, like Ellie is.
Well, it's also, my thing, I use these long-lasting lipsticks and they're quite drying.
Yes.
So I often need the lip balm just because I put long-lasting lipstick on.
Yeah, so you think the lipstick irritates the skin?
No, it's just to make it last on the skin, it sort of dries onto the surface. That's how it gives it its tint. And then you need the lip balm to create moisture because it dries it out.
Oh.
Yeah.
And to wrap this episode up, we have one final question on beauty sleep. So one of the questions that's come in from Matthew is, what is the correlation with getting good quality sleep and its healing effect on the skin? And you wrote an article on this recently, so do you want to answer it?
Yeah, so people shouldn't beat themselves up if they get a few bad nights of sleep or if they have a bit of a run of bad sleep, especially those that have young kids like myself, where you don't get good sleep very often. Don't need to really stress about it and add to their worry. But essentially, one night of poor sleep can affect the way that we can feel the next day. We know that because you wake up just feeling a bit rubbish. And poor sleep can elevate our cortisol levels, it increases inflammation, and it can actually even break down our skin's collagen and hyaluronic acid. You can't bank sleep though, and having a good restful night of sleep can help with the repair processes in the skin. So our skin follows a circadian rhythm or an internal clock where it goes through a repair process at night and it tends to be in a protect mode during the day. So it's brilliant to get a good night's sleep because you can get all of those repair processes happening in your skin in an optimal way. So that's why sleep is good for skin, but also sometimes you just can't help having a bad run of sleep.
So that's a wrap for today's episode of the After Hours Skin Clinic. Thank you to Lily, Matthew, two of Christine's friends, Alice and Martine for sending in your questions. We love hearing from you. If you've got a question you want answering, send it in. We want to keep tackling the subjects that mean the most to you. Details of how to get in touch are in the show notes. And if you know someone who'd find this episode useful, then do share it with them. And don't forget to give us a follow. Don't even think about it, just do it. Ellie, thank you so much for joining me today.
I have loved every second.
And thank you, my lovely listener, for joining us. Bye for now, take care of yourself and your skin, and don't forget your SPF. And see you next time on the After Hours Skin Clinic.